One of the most mind-blowing concepts about the human body is just how individual we are. Did you know that you have a unique biochemistry that's the sum of many factors, and these factors are shifting, sometimes going through cycles and adjusting and rebalancing? So why does that matter? Well, here's my friend and colleague, Dr. Michael Berglund, with a valuable perspective when it comes to your health, why it really does matter that we're all different.
One of my frustrations as a practitioner is that the medical system tries to treat people as an average person. And studies, when they're done, they try and say, well, this is the response. 40% of the people respond to this drug this way. But the problem is that we've got 60% of the people that responded a whole different way, and who are those 60%? And the challenge is we're all different. There's a huge genetic variation of us, and if that wasn't enough, then there's a huge amount of us that live differently. We have different personality types that are wired differently, and we live in different environmental factors. Some of us are working, some are staying home, some are very high stress people, some are very chill people, and that all those factors play a role in who we are. And the doctors need to understand that. I always tell people, like when they come in, that I'm helping them write their own textbook. Their textbook may not really accurately define who they are. In fact, Gray's Anatomy tells them where their heart's going to be, where their liver's going to be, where their spleen's going to be. But physiologically, some of the things that it says in textbooks and research papers and our classes don't often reflect that person and how their body acts. So some of the explanations that we don't really need to decide, well, why when I'm sleeping and my shoulder's uncovered do I notice I wake up more often sick in the morning? Well, we don't have to explain that. If that's your reality, that's your reality. And my job is to try and help you understand your system best. And so as alternative practitioners, we're more prone to not going off of using recipes and formulas that we got off research papers, but actually being intuitive, trying to help patients figure themselves out and be able to pinpoint where the real problems are, and using our anatomy and physiology backgrounds and knowing all the things that we know help assess and figure them out. So, and we have the ability to throw different things in. I always say some of the clinical things that I do are about like running experiments. I sit there and say, let's try and see what happens when I do this. Let's try and see what happens when I do this. And the thing is, we're using non-toxic herbs and vitamins and minerals. And so the idea is that we're not going to create a ton of problems by experimenting. In fact, we may learn a lot of things about how this person responds to things. I encourage you to find practitioners that actually can understand you, because the idea is we are all different. There's a huge variety of us, and your doctor's job is to help you live your life to the most complete that you can.
Medical science and nutritional science are advancing, and we're understanding more about this principle of everyone's biochemical individuality. That long list of side effects at the end of drug ads is a good example. Why are there so many different side effects? Because people are biochemically different. But hopefully with wellness care and functional medicine, we can take that uniqueness and turn it into an opportunity. Instead of drugs, we can feed the body what it needs. Stimulate hormones and balance pH, or whatever else you need to do to take your health to the next level. Ask your wellness professional about questionnaires and tests that can help determine your biochemical individuality and what works for you.